Now, while the advancement in treatment strategies over the years have saved patients many years of their life, it's also brought to the fore many different adverse effects that impact one's quality of life. At this time, we'd like to talk a little bit more in depth about survivorship. I feel it's very important that we raise awareness about any preventative measures and set expectations of the treatment for our patients. As we have learned, treatment for your cancer has the potential to impact many different organs in your body to some degree. Now we're going to even go into more detail about them and what can be done to prevent them. So, like I've been talking about, there's a risk of secondary malignancies or cancers that may happen years later. Well, radiation and chemo individually are linked to about a twofold increase in this, but if they're used together, it causes about a threefold increase of both blood cancers, so this is leukemia or myelodysplastic syndrome, and solid tumors. Solid tumors, and when I say solid tumors, I'm talking about like colon cancer, gastric cancer, bladder cancer, and the median latency for this is about 12 to 14 years, although the risk persists for years following. In terms of other blood cancers like leukemia, the median latency is about 3 to 7 years. And then there are lifestyle factors, but Dr. Jotwani, what are other ways we can help mitigate secondary malignancies in patients?
Some of the mitigating factors that I do want to consider or do consider in my patients is definitely smoking, as it is one of the most common carcinogen. Alcohol could be a big risk for our patients. These are some of the mitigating factors that we definitely speak to our patients about regularly. Um, Having these risks and understanding these risks, getting your regular primary care checkup, checking your blood counts regularly helps, making sure you go through the screenings, whether it's a lung cancer screening, your colonoscopies, these are all important factors. So, especially in our cancer patients, we encourage and advise them to adhere to these guidelines as much as possible because they are at a higher risk than normal population to get any of these cancers.
Absolutely. So, another risk is that of cardiovascular disease. So, usually this is a late effect of platinum-based chemotherapy, although it can also happen after getting radiation. The risk is predominantly in the first year after getting chemo and decreases over the course of time after that. But individuals, once they've gotten treatment, are still about 40 to 60% more likely to have a major cardiac issue, even in up to 20 to 30 years after treatment. So, there's a lot of things we can do to mitigate this risk. Most of them are lifestyle and behavior changes. Like you mentioned, smoking cessation, cutting back on heavy alcohol consumption, leading a more active lifestyle, making sure you're not overweight, closely monitoring blood pressure and cholesterol, and acting early with interventions when you do see that you're hypertensive or have hypercholesterolemia. Is there anything you would like to add, Kron?
I think, as you correctly have mentioned, I think the risk definitely increases over time, decreases over time, but the majority of the risk is in the first 1 to 2 years. But yes, again, primary care follow-up, making sure you're going to your doctors regularly, getting your lipid panels done. If needed, use your statins. These are cholesterol lowering drugs. Again, as you mentioned, monitoring of blood pressure, and making sure exercise is integrated into your lifestyle as much as possible.